Dear students, now we are going to see the medial compartment of the thigh. Okay, see, thigh is having anterior, medial, and posterior compartments. See, medial compartment mainly five muscles are there. What are they? Adductor longus, adductor brevis, adductor magnus, then gracilis and pectineus. Okay, these are the five muscles. What are they? Adductor. See, medial compartment is otherwise known as what? Adductor compartment. Okay, so adduction. So adductor compartment. So three mainly five muscles are there. What are they? Adductor longus, adductor brevis, adductor magnus, then gracilis and pectineus. So we have to see the details of these five muscles. First we will see the adductor longus muscle. It arises from or origin from anterior surface of the body of the pubis, inserted to linea aspera in the middle one third of the shaft or middle part of the linea aspera. Okay, so what is meant by that? See, origin. First we will check the origin. Anterior surface of the body of the pubis. See, this is what the pubic bone, the body, then superior ramus, inferior ramus. Okay, so anterior surface of the body means the, see here in this image, now we can see the anterior surface, this area. This is what the anterior surface of the pubis. So this muscle is rising from this anterior surface. From here it runs laterally like this. See, from here it runs laterally. Opposite side, from here it runs laterally and it reaches the posterior border of the femur. Okay, see, posterior border, this posterior border. It is known as what? Linea aspera. Okay, so from the body of the pubis to the middle part of the linea aspera. That is what the adductor longus. Now it is clear, anterior surface of the body of the pubis inserted to linea aspera in the middle one third of the shaft. Now we'll see the diagram. See, this is what the adductor longus. See, it is rising from the body of the pubis, correct? From there it runs downward and laterally and reaches the posterior aspect of the femur. There it is inserting to the posterior border of the femur like this. Okay, so adductor longus. Now adductor brevis. It's a small muscle, that's why it's known as adductor brevis. Now origin. Anterior surface of the body of the pubis, no doubt. Then outer surface of the ischiopubic ramus. See, means, say here, this is what the ramus of the pubis, inferior ramus of the pubis. That inferior ramus of the pubis joins with the ramus of the ischium. See, this is what the ramus of the ischium. Okay, now this ramus, it is known as what? Ischiopubic ramus. Okay, ischiopubic ramus. So this muscle is arising from anterior surface of the body and outer surface of the ischiopubic ramus, means from here. Anterior surface of the body and outer surface of the ischiopubic ramus means this area. Okay, so that origin is clear. Anterior surface of the body and outer surface of the ischiopubic ramus, and it is inserted into the spiral line. What is that spiral line? See here, this linea aspera here in the upper part divides into two. Lower part also it divides into two. So here in the upper part, this medial one, this is what the spiral line. And this one here we are having a elevation, that is what the gluteal tuberosity. Okay, so this is what the spiral line. So it is inserted into the spiral line. That is what the brevis. Now we'll see that. See this one, this muscle. This is the brevis. Okay, see here, it is arising from the body, adductor brevis. Okay, it is arising from the body of the pubis and the ischiopubic ramus. From there it runs downward and laterally and inserted to the spiral line of the femur. Origin and insertion of adductor brevis is also clear. Now adductor magnus. Adductor magnus origin from the infralateral part of the ischial tuberosity. Then outer surface of the ischiopubic ramus. Infralateral part means I already told you the ischial tuberosity, which is divided into upper part and lower part. From that lower part, it is arising from that lower part of the ischial tuberosity. Then not only from the ischial tuberosity, outer surface of the, see, this is the ischial tuberosity. Imagine this is ischial tuberosity. Okay, it is divided into upper part and lower part. Okay, upper part is divided into medial and lateral. Lower part is also divided into medial and lateral. So that lateral part. Anyway, it is arising from the lower part of the ischial tuberosity, then outer surface of this ischiopubic ramus. See, from this area. Okay, so adductor longus is from the body, adductor brevis from the body of the pubis and this ischiopubic ramus. Now adductor magnus from the ischial tuberosity and this ischiopubic ramus. Okay, so origin, it is clear. Lateral part of the ischial tuberosity, then outer surface of the ischiopubic ramus. Now insertion, medial margin of the gluteal tuberosity, linea aspera, medial supracondylar ridge, and adductor tubercle. What is meant by that? See here, I already told you this is what the gluteal tuberosity. So medial margin, this dotted line represents the medial margin. So medial margin of the gluteal tuberosity that continues with the linea aspera. Then here, medial supracondylar ridge. It ends in elevation. See here in the medial side, there we can see one elevation, adductor tubercle. So adductor tubercle. Okay, so medial margin of the gluteal tuberosity, then linea aspera, then medial supracondylar ridge, and adductor tubercle. So it is inserting to those points. Okay, arising from the lateral part of the ischial tuberosity, ischiopubic ramus, outer surface of the ischiopubic ramus, and insertion to the medial margin of the gluteal tuberosity, linea aspera, medial supracondylar ridge, and adductor tubercle. Now see the muscle. See this one, this large one. This one is adductor magnus. So adductor longus, adductor brevis, then adductor magnus. This adductor magnus, it is having two parts, one hamstring part and one adductor part. Hamstring part means those fibers arising from the ischial tuberosity are known as what? Hamstring part. Those fibers arising from the ischiopubic ramus are known as adductor part. Okay. Now the remaining two muscles, gracilis and pectineus. Gracilis arise from medial margin of the lower part of body of the pubis. It is arising from the body of the pubis, but not from the anterior surface. It is arising from the margin, medial margin of the pubis, then outer surface of the ischiopubic ramus. We'll check it. See, this is the medial margin. This ridge, this one is a medial margin. This is the anterior surface. Now it is arising from the medial margin, not from the complete medial margin. It is arising from the lower part of the medial margin. Okay, then not only from there, it is arising from the this ischiopubic ramus. So from this area. Okay. So medial margin of the lower half of the body, or it is arising from the medial margin of the body of the pubis and the outer surface of the ischiopubic ramus, inserted to the upper medial surface of the tibia, medial, not medial of the tibia, medial surface of the tibia. This is inserted to the medial surface of the tibia. Okay, see this one arising from the body and the ischiopubic ramus runs downward and reaches the tibia. And it is inserted to the medial surface of the tibia. Now the last muscle, pectineus muscle. Pectineus muscle origin from the pecten pubis and upper half of the pectineal surface of the superior ramus of the pubis. What is meant by that? Pecten pubis. Pecten pubis means it is nothing but the superior border of the pubis. Okay, pubis. It is having superior superior ramus of the pubis is having superior border, then anterior border, inferior border. That superior border is known as what? The pecten pubis. Now imagine this is a superior border of the pecten pubis. This is the anterior border. This is the inferior border. Now this surface between the superior border and the anterior border, it is known as what? The pectineal surface. Okay, so pecten pubis means the superior border. Then pectineal surface means this surface which is seen between this pecten pubis and the anterior border. From these 2 points, from this margin and from this surface. Okay, it is arising from this area. Okay, that is clear now. Pecten pubis and the pectineal surface of the pubic bone, insertion to the spiral line. Already showed you the spiral line. See, almost like this. This is what the pectineus muscle. So origin and insertion of these muscles are clear. And I told you this is the adductor compartment. So no doubt these muscles adducts the thigh. So these are the adductors of thigh. In addition to that, it is some of the say adductor longus, brevis, and the upper part of the adductor magnus flexes the thigh. Okay. So these are some of the important actions of these muscles. The nerve supply is supplied by the obturator nerve. Okay. See, this is what the adduction. In this image, we can see the adduction of the hip joint. Okay, so these are the details of this medial compartment muscles or the adductor compartment muscles.